I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You are the face of CHS, and we thank you all for all you do for your patients and residents every day. Specialty centers located within CHS hospitals ensure our patients have access to state-of-the-art technology and the best specialty providers and services. With a long history of caring for patients in our communities requiring specialized care for their diabetic or other non-healing wounds, CHS now offers multiple centers for hyperbaric medicine and wound healing at Mercy Medical Center in Rockville Center, St. Joseph Hospital in Bethpage, and St. Catherine of Siena Medical Center in Smithtown. Another specialty center available at multiple CHS hospitals are our centers for sleep medicine, where potentially serious disorders can be diagnosed quickly and conveniently in a comfortable and contemporary hotel-like settings. Mercy Medical Center and St. Joseph Hospital have successfully been improving the lives of their patients through these 2 specialty services. Joining me today are Ron Steimel, the Executive Vice President and Chief Administrative Officer of Mercy Medical Center and St. Joseph Hospital, Dr. John Jackalone, Medical Director of the Center for Hyperbaric Medicine and Wound Healing at St. Joseph Hospital and Mercy Medical Center, and Dr. Chrysula Polides, the Director of the Center for Sleep Medicine at Mercy Medical Center. We look forward to discussing these specialty centers with you on today's episode of CHS Presents Health Connect.
As farmers and ranchers, stewardship of the land comes naturally. We help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Hello, and welcome back to CHS Presents Health Connect. Today we're highlighting 2 of Catholic Health Services hospitals, Mercy Medical Center in Rockville Center and St. Joseph Hospital in Bethpage. Joining me now is Mr. Ron Steimel, the Executive Vice President and Chief Administrative Officer of the 2 hospitals, to discuss some of the specialty centers offered at these locations. Welcome.
Thank you, Dr. O'Shaughnessy.
Ron, it's great to have you here. So tell us a little bit about Mercy Medical Center and some of the awards and accreditations it has.
Well, as you know, Patrick, Mercy Medical Center has had a long-standing history in the community of Rockville Center and surrounding communities. We were founded over 100 years ago by the Congregation of the Infant Jesus. So for over 100 years, Mercy's had a standard of quality and compassionate care and a faith-based organization. Mercy typically is about a 225-bed. While it's a community hospital, I wouldn't say it's a traditional community hospital. We have a wide array of services. But I think most importantly, Mercy has responded to the changes in healthcare that we all face. The inpatient platforms of yesteryear are gone. There needs to be an intent focus on outpatient services to support what we're doing on an inpatient basis. Mercy, I think, to a large extent, has a lot of different services on the inpatient side. You know, we have what we call the hidden gem of Long Island, a 37-bed inpatient acute rehabilitation center.
Yes.
As well as we have a level 3 NICU for our premature babies. We have a well-respected oncology unit. We do mother-baby services. We also have inpatient behavioral health beds. as well as many other inpatient services. So we traditionally don't do a lot of work outside of what people would consider to be a community hospital.
Very comprehensive what you're offering on the campus.
Absolutely, on an inpatient basis. But in order to be able to change, we had to really profile our inpatient services, but go look for niche services on an outpatient basis, because more services are moving from inpatient to outpatient.
So you mentioned that shift in healthcare, and we see this across the whole healthcare environment, from inpatient to ambulatory.
Correct.
Share a little bit about some of the ambulatory programs you have in place. Anything new and specific that you'd like the viewers to recognize?
Sure. One of the things, since we have an inpatient acute rehabilitation unit, Mercy never had an outpatient rehabilitation program or physical therapy program to support our inpatient services. So we opened up an outpatient rehabilitation therapy services, which has been booming to the extent where we've expanded into evening and into weekend hours.
Wow.
On top of that, we have a new relationship with Malloy College, where we provide their sports medicine for their student athletes, and that's been proven to be very successful. As we'll talk later with the other guests, we've opened up our Hyperbaric and Wound Care Center, and the support from the physicians and the staff has been tremendous. We just opened up our Sleep Medicine Center, and that's proven to be very well received, not only by our patients, but the community as well. And those are much needed services.
So let's talk a little bit about those two services in particular. So let's start with wound care. What kind of services are offered in the wound care center, and how do you provide them at Mercy Medical Center?
Well, I would say it's interdisciplinary.
Yes.
A lot of being that we have a 225-bed inpatient platform at Mercy, a lot of our referrals come directly from our inpatient program. There are a lot of patients that are in the inpatient setting that have wounds that need to be addressed, not only on an inpatient basis, but then when they're discharged. As we all know, the length of stays in hospitals have been requested to decrease them as much as possible, so we need to provide those services on an outpatient basis. So we try to get as many patients as we can on the inpatient side and then follow up with them on an outpatient basis. Right now, Mercy has a very successful wound care program, but we also have two and just added a third hyperbaric chamber for our patients that we serve because of the need that we have seen. And it's not just patients that we discharge from the hospital. We have great relationships with the various nursing homes in our community, and the patients at the nursing homes who have wounds that can't be addressed at that site, we will take care of them at Mercy, as well as from home care agencies that have typically been able to try to treat wounds at the house, but when they get to a point where they can't handle them anymore, Mercy's there for them.
That's wonderful. And there's so much that we can continue to talk about Mercy Medical Center,
Correct.
but you have the distinct honor and pleasure of leading two of our campuses. Let's segue a little bit now into St. Joseph's Hospital. Share a little bit about St. Joe's and Bethpage and the services that you have on that campus.
Yeah, I will echo what you said about being a distinct honor to serve both campuses. I do feel that both are your community hospitals. St. Joseph's is a smaller platform. It's 100 beds. And it's located in Bethpage, New York, and it used to be the old Mid-Island, then the New Island, and now 5 years ago it became part of Catholic Health Services. So with the support of Catholic Health Services, I think St. Joseph's has been able to strive. Typically, we'd see about 36,000 ER patients, emergency room patients, annually, which is pretty busy for a small community hospital. I will tell you that I think one of the most outstanding things and intriguing things about St. Joseph's is the community support.
Yes.
I've worked at many other facilities, and I've never seen a community that supports St. Joseph's as much as the community in Bethpage, Massapequa, and the surrounding areas, Farmingdale and other areas. They totally support St. Joseph's and wanted to see it thrive. St. Joseph's is typically a medical surgical hospital. We specialize in orthopedics, podiatry, vascular, as well as provide cardiac services for stabilization and then transfer to one of the other CHS facilities, namely St. Francis
And you
Hospital.
just opened up a cardiac CT program there. Can you take just a minute and share a little bit about that program?
Yeah. I think that's one of the most interesting things for St. Joseph's. We're a small community, 100-bed hospital, and to be able to have that type of technology, cardiac CT imaging, whereby a patient will come in for a cardiac CT. It's a very quick procedure.
So that's a CAT scan.
Absolutely.
You just go in, it's like an X-ray for our viewers at home, and it takes a picture of the coronary anatomy, allowing the physicians to see if you have any blockages in a
Correct.
non-invasive manner.
Yep, and you look at the plaque, score, the calcium scoring, to see how the patient is doing. And it pinpoints a lot of early disease that typically would not be picked up on other types of modalities. And the interesting thing is we've only had the program operational since February, and I will tell you that we've probably saved some people's lives even in the early stages of this program. And plus having the support of St. Francis Hospital, which is the heart center, if we have a patient that needs follow-up cardiac intervention, we can send them over to St. Francis.
Well, that's wonderful. Ron, we could literally spend an hour talking about the services, and I do want to share the fact that both of the campuses are really providing incredibly high quality and customer service focused care, and I want to thank you for joining us. We'll continue our discussion about our wound care and sleep centers at CHS right after this. Welcome back to CHS Presents Health Connect. For patients with chronic wounds, CHS's Center for Hyperbaric Medicine and Wound Healing offers a comprehensive multidisciplinary treatment proven to increase positive healing outcomes. Joining me now is Dr. John Giacalone, Medical Director for the Center for Hyperbaric Medicine and Wound Healing at St. Joseph Hospital and Mercy Medical Center. Welcome, Dr. Giacalone. Thanks for coming in today.
Thank you for having me.
It's a pleasure. Tell us a little bit about the types of patients you treat at St. Joseph's and Mercy's Hospital.
So most of our wound care patients have some underlying metabolic abnormality or deficiency, which makes them basically poor healers. So where you and I would develop a wound and it would close in a relatively normal amount of time, these folks have wounds that don't want to heal. A lot of times it's related to blood flow issues. Most of our patients are diabetic, not all. We do have some patients that suffer from traumatic wounds. Interestingly, we have patients that have wounds from radiation therapy from cancer treatment, when we can do some wonderful things with them also. So there's really a wide range of what we treat, but for the most part, they're people with underlying metabolic abnormalities.
So usually it's a combination effect that's leading to this disorder. There's some underlying disease process, and then or perhaps an injury, or perhaps as a sequela of another treatment, they're not healing and they come and see you. Tell us a little bit about the types of services. How does this treatment improve wound healing?
So the benefit of being in a wound care center is that you have multidisciplinary teams. So if someone comes to me, I'm able to identify it very quickly because I'm located in a hospital. And by that I mean I can send a patient right across the hall and have an MRI done, vascular study the day that you come in. And then I can route you to the appropriate care member of our team. Time is of the essence. It's not like a heart attack emergency, but the longer you wait, the more tissue a patient's going to lose, sure, and the more it's going to affect their life. So working in a smaller hospital, I believe medicine is belly to belly, and I love walking across the hall, speaking to my radiologist or my vascular tech and saying, this is Mrs. So-and-so, this is what we're looking for with her. And in that case, we can really correct the abnormality, and we can get the patient to heal. In the private office setting, you might have to write a prescription. Patient has to find an appointment with a vascular lab or an MRI. Yes. So by the time you get your answer back and treat that patient and put him in the right direction, it could be 2 to 3 weeks. And that's really a long period of time when you're dealing with a wound.
Well, I've actually had the pleasure of seeing you operate, no pun intended, at the Wound Center at St. Joseph Hospital. And just as you've described, everything is there. Yeah. Radiology is right across the hallway. You have the whole center orchestrated beautifully with a multidisciplinary team. So between vascular surgery, podiatry, radiology, you have everything you need. What's the hyperbaric component? How does that work?
So basically, most of these wounds are not healing because the abnormality is causing a lack of oxygen or a lack of blood flow to the wound. There are other factors. There's nutrition, there's offloading a wound that might be from pressure, but really oxygen is the key, okay? Blood is the most important thing. The way I describe it to my wounds is if you planted a tomato plant and you tried to grow it without ever watering it, it would be the same as trying to heal a wound without blood flow.
So really trying to get oxygenated
Correct.
Blood to that wound.
Right now, breathing this air, there's a certain percentage of oxygen in the air. And what drives that oxygen into your bloodstream at the level of your lungs is atmospheric pressure above you, the weight of the air. When we put you in a hyperbaric chamber, we're basically doubling the weight of that air. So as you take a breath in, you don't feel anything different, but on that biological level, that's correct. So we're packing more oxygen in your bloodstream. Now, back to your original point, if you don't have blood flow to the affected wound because of a blockage or a vascular condition, we can put all the oxygen we want into your bloodstream. It's not going to help you. So having that vascular surgeon at my fingertips to say, hey, take this patient to the operating room and fix it, well, now the oxygen therapy works really well. So you have to kind of optimize that healing machine that's attached to the wound, and that's the patient's.
Absolutely. Now, how about you're at two centers doing this now?
Yes.
So tell us a little bit about your experience, and do you think that there's an advantage of being part of an integrated delivery system like Catholic Health Services?
Tremendous part. Going back to what Ron said earlier, if you have a patient that needs vascular intervention or cardiac intervention, we have St. Francis Heart Hospital. We have wonderful, physical medicine and rehab qualities that we can bring to bear on a patient that may have had an injury or a wound that didn't heal, may have lost, something and now needs to learn to walk again or needs to learn to get back. We have all those services in a hospital. In a private office setting, again, you're writing referrals, you're sending patients, they're waiting for appointments. So we can call any number of specialists in to help us. It's very, very powerful.
So building upon that point, for our viewers at home, can you share with them how they get a hold of you? I mean, just some incredible services being offered at multiple campuses within the CHS system, but how can folks at home, if they know a loved one or they're having an issue with wound healing, how do they get into a center like you run for us?
Well, a lot of times they'll be referred in by their primary doctor, but if there's anyone watching who has somebody who needs help, they can call Mercy at 516-62-MERCY is the number there, and then just ask for the wound center. And at St. Joseph's, we're at 516-520-2788. You call us up. We have intake personnel who go through everything, your past medical history. It's about a 10-minute phone call. They'll ask you about your insurance coverage. We make sure all that is taken care of and pre-authorized before you come in. So we really do kind of make it a one-stop shop.
So they'll take the patient right on through, navigate the whole process, make it easy, and get them into really the services that they need. That's really wonderful. I can't thank you enough for sharing the wonderful services that you lead on and help provide for our patients at CHS. Thank you to Dr. John Giacalone for joining us. We'll be right back with more CHS Presents Health Connect.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Welcome back to CHS Presents Health Connect. Sleep disorders such as snoring, insomnia, and sleep apnea can seriously affect your health and an individual's quality of life. To assist in diagnosing and treating these potentially serious conditions, CHS offers the latest sleep technology in suites that are comfortable and contemporary. Joining me now is Dr. Chrysula Polides, the Director of the Center for Sleep Medicine at Mercy Medical Center. Thank you, Dr. Polides, for joining us.
Thank you. Pleasure to be here.
So this is a very, very popular topic. Sleep is so important, and I know our viewers at home, and even myself and my family, we often can say to ourselves, boy, we're just going to have a rough day today because we didn't get a good night's sleep. But this is a real serious issue for so many millions of people throughout the world. Tell us a little bit about what constitutes a sleep disorder and how folks can then begin to think about, do I need to get seen for this?
Sure, yeah. So a sleep disorder is really any chronic complaint of sleep a patient may have that could potentially interfere with their mental, physical, or emotional well-being. Some examples of sleep disorders include restless leg syndrome, insomnia, narcolepsy, or even abnormal behaviors that may come out during sleep. But perhaps one of the most widely recognized sleep disorder is called obstructive sleep apnea. This occurs when the muscles in the throat intermittently relax and they can block the airway, which causes breathing to repeatedly start and stop, kind of start and stop cyclically throughout the course of the night. And sleep disorders are much more common than we actually think. And for example, problems with falling asleep or staying asleep at night can occur in up to 35% of the population. And in addition, for instance, it is estimated that 26% of the U.S. adult population between the ages of 30 and 70 actually have sleep apnea.
Did you say 26%?
26%.
So nearly 1 of 4 people may have sleep apnea. So this is an important point. So, if I'm going to bed and my wife is having periods of snoring in and out, and when do you start saying what's apnea and what's just snoring? And how do you know? And when should someone say to their doctor, I think I need to be referred to a sleep specialist like yourself?
Right. So Snoring, obviously, it could affect the person itself. So somebody can awaken themselves snoring and or snorting, gasping for air, and that's obviously a problem if it's happened repeatedly. But more often than not, it's a spouse that tells the person, hey, you know what, your snoring is very loud and disruptive, or if there's other family members in the house that can hear it, then at that point it probably warrants an evaluation.
Are you hearing this, honey, at home? Yes. So that could be an opportunity for an evaluation.
Yes.
All kidding aside, some very serious pathophysiologic changes can happen to the body, including strain on the heart and whatnot, if this is not recognized and diagnosed.
Correct.
So share with me a little bit about how do you evaluate these problems? What is a sleep study, and what would you do to a patient when they do come into one of our contemporary, beautiful suites?
So the first step is really alerting patients out there that why they may need a sleep study. So a sleep study is basically an overnight sleep study is where you go to a facility or a lab and you literally spend the night there and you sleep while you're being monitored.
Like checking into the hotel.
You're checking in, exactly.
Yeah.
So in our setting, it's a beautiful hotel-like environment that is fully equipped with bathrooms, showers, TVs, and sophisticated monitoring equipment. And when you get there typically in the early evening where you're greeted by a licensed and certified sleep technician and shown to your room. Our facility is conveniently open 7 nights a week, but we also have the capabilities of conducting daytime studies on an as-needed basis. A person that may need a daytime study is somebody that's what we call a shift worker. A shift worker works at night, correct? So you know, works at night but sleeps during the day. So we can accommodate patients' busy schedules and their lives, basically.
I should have did this when I was working nights in the emergency room, because what I used to do was sneak after my shift before driving. I'd go catch an hour or two in the sleep lab if there was an empty bed. So yeah, absolutely, that whole circadian rhythm. So a lot of folks that are doing shift work, that could be an issue as well. How would a patient get referred to you? Is this, would they go see their primary care doctor first? Tell the viewers at home, how could they get plugged in with the appropriate specialist like yourself to receive this type of care?
So they can directly seek the expertise of a sleep specialist. I believe our number is 516-62-MERCY, and they can refer you to our clinic where you can be seen. But the first step is also speaking to your doctor about your symptoms if you think you may have a sleep disorder or your spouse may have a sleep disorder. And at that point, after speaking with your doctor can refer you directly to our sleep center.
Wonderful. So that's really a great way that folks can get in and get seen. Now, are these tests covered by insurance? Are these things that people need to worry about in terms of out-of-pocket expense?
No, most of our diagnostic tests and treatments are covered by most insurance plans, and the process is pretty seamless. Once the referral is received, our staff will then go ahead and handle the insurance authorization process, and once that's been approved and all set, our staff will contact the patient to set up a study at the earliest convenience.
So again, they'll concierge the patient right on through, take them through soup to nuts.
Patient just shows up.
Just show up and check in and try to get a good night's sleep, and we'll see what we find.
That's right.
So that's wonderful, Dr. Pleas. I want to thank you for joining us today on our show. We'll be right back. Hello and welcome back. I'd like to share some final thoughts on today's topics for our viewers at home. So some very common and important things were introduced today regarding sleep disorders and how to better manage wounds. I'd like to talk a minute about sleep disorders, and as you heard Dr. Polides say today, nearly 1 in 4 people, actually more than that, 26% of the population may have sleep apnea and not even know it. So if you're at home and you hear a loved one having irregular respiratory patterns and have pauses in their breathing, that's a sign that should be evaluated. Get them in to see their primary care doctor, get a referral to a sleep center. It'll not only help them feel more rested and healthy, but it actually could really help save their lives, because progressive sleep apnea can lead to some serious physiologic changes that can put strains on the heart and the lungs. And so much of what we share here on our show is really about how to keep you healthy. And I used to have patients all the time say to me, Dr. O'Shaughnessy, I know I saw you in the emergency room, but can you be my regular doctor? And I would say to them, quite frankly, I hope I never see you again, because if I do, it means something went wrong. You're back here in the emergency room. So we really want to focus on how to keep you healthy. And while we shared today some wonderful, incredible treatments for how to help wounds heal, many times chronic wounds are a sign of chronic illness. And how do we prevent that? How do we mitigate some of that from happening? Now, we're not going to solve all chronic disease, and as we age, we become more susceptible to these processes. But staying healthy, keeping our body mass index down, and trying to, if not prevent diabetes, at least delay its onset, and then once it is recognized and diagnosed, really making sure we're on a tight treatment plan to keep our hemoglobin A1C, or a measure of how well we're controlling our sugar, in check. These things can all help us stay healthy and help us prevent some of the wound issues that Dr. Jackalone described that we manage and treat at our wound care centers. So let me share with you a healthy tip before we close this segment. Sedentary lifestyle is becoming a huge challenge for our population. So many of us, myself included, are now faced with situations where the majority of our days are spent just like this, in a chair. And that has serious health repercussions. The Centers for Disease Control recommend that we get out and walk 150 minutes a week. Now, that does not mean that you have to be in a gym 2 hours a day to achieve this. Just get up and walk. If it's at your office, get out of the chair. Walk around the office. Take the stairs. Take the elevator. For your lunch break, get out and walk around the building. You'd be amazed at how quickly you could achieve this goal and be on a path to health and wellness. If you'd like to know more about CHS's Centers for Hyperbaric Medicine and Wound Healing, or Centers for Sleep Medicine, or would like to make a gift in support of these or other programs, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support, because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions that you'd like me to answer on future shows, please email us at healthconnect@chsli.org. Please do include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.